Welcome to Luca and Miguel. Enjoy the video.
You begin by readying the Microlet Next and the test strip. Do this now. First, load a new lancet into the device, twist off the cap, insert, and secure it so the mechanism works reliably. Once done, choose a depth setting, lower for thin skin, higher for calloused areas. Make sure your hands are clean and dry. This protects sample accuracy. You're starting the process immediately, so work confidently and keep the device pointed away from yourself until you're ready to lance. Now you move into the core technique, priming and lancing. First, cock the device until it clicks so the spring is ready. This ensures consistent penetration. Then place the tip flat against the fingertip side or alternate site and press steadily. When you release the trigger, the lancet will penetrate quickly, minimizing pain. After the puncture, squeeze gently from the base toward the tip until you see a droplet of blood about the size needed. Make sure not to squeeze too hard. Finally, you collect the sample and finish the cycle. Hold the test strip to the blood droplet so capillary action pulls it in, do not smear, and make sure the strip's window fills. Once testing is complete, remove the lancet and dispose of it in an appropriate sharps container to prevent injury. If you fail to get enough blood, re-clean and warm the site, then try again at a slightly higher depth. This troubleshooting tip solves most issues without forcing repeated lances.
Thanks for watching and please subscribe. It's the best investment you'll ever make.